Hello, hello, hello. It is Mondays, and you guys know what time it is. It is time for Medical Monday with Dr. Grace here in the Metro Detroit area. Yes, it is October the 2nd, and it's fastly approaching 8 p.m. So I got on a little bit earlier on today because we're trying something a little bit different. We are on the Medical Monday page today, so hopefully you guys will be able to find me so you can get on and get your questions answered and everything like that. Hey Tanisa, thank you for getting on. I appreciate you. Please invite and share. Please invite and share. I am the Dr. Grace in the Metro Detroit area, owner and founder of Bethesda Holistic Center in Southfield, Michigan, address 21411 Civic Center Drive, Southfield, Michigan, zip code 48076. And our telephone number is 248-356-1111. Bethesda Holistic Center is known for serving the whole man, spirit, soul, and body, and your mind. Bethesda is known to help you quiet your mind, because we talked about that in quite much detail before. Also to nourish and cleanse the body, and to quicken and awaken your soul. That's what we're known for. That is our motto. That is our logo. So I'm giving you guys a chance to chime in here. Hopefully everyone can find me here on the Medical Monday page. It's only appropriate for me to do it on the Medical Monday page because it is titled Medical Monday. So tonight we're going to be talking about flu. This is what we call the flu season, and we're going to be talking about vaccines, the flu shot, and other vaccines that are available to you. And I'm going to inform you on tonight what would be the best way for you to build your immune system. So please get some paper and get a pen, like I always encourage you guys to do, to take down some notes so you can apply it to your life, to have an impact and to change your life. So please, everyone, please invite and share. Let everybody know that I'm on the Medical Monday page so we can move forward quickly and get this information done. Okay, I'll give you guys I'll start at 8:05. It's 8:03, so please invite your friends and share. I did put it on my page for people to come to the Medical Monday page, and so you guys can get the information that we have for you all on tonight. Again, my name is Dr. Grace Patterson. Yes, I do have my medical doctorate from Wayne State University School of Medicine. I am a doctor for a little bit over 20 years now. So I've been on Medical Monday now since April, May, June, July, August, September, October, for 6 months now. Wow. And we have done over a merit of information. So we're here every Monday at 8 p.m. So please invite and share. Let everybody know to find my Medical Monday page. That's Medical Monday. So you guys can get the video and replay it. I am going to start showing my old videos on Medical Monday, so you guys can have a catalog of videos that you can go back and watch and share. For you replayers who were not able to make it on Monday at 8 p.m., I welcome you and I challenge you to change your life. Make good choices, good health choices in regards to your health. It is 8:05. I'm trying to get people to sign on to Medical Monday. It was advised to me to separate the two, my personal page from my to my business page. And normally by now I have more than 2 viewers. Normally when I'm on my friend page, but it is a leap of faith to change and do what is most appropriate to build and grow and to stretch. So please, those of you under the sound of my voice, please invite and share because we have a whole lot of information to go over tonight. Hey, Jonah, thank you. Want to bring them on as they get. Oh, hey, Jonah, thank you for joining on, dear. God bless you. My friend, Jonah Stout from Texas. Thank you for joining on. Please invite and share. Yes, I posted where I've been advised by one of my marketers to separate my friend page, which is my personal page, to my business page. So I'm trying to be obedient. So how many other people are looking for me too? So we're going to give people a few more minutes to try to find me. I did post on my page to go to the Medical Monday page. Maybe I need to sign off and get back on and let them know where they can find me. Yep, they're right. Yeah, I know they're right, but by this time I would have more than 2 viewers if I was on my personal page. So maybe I need to go to my personal page and do a video and tell them, hey, I'm on my page so they can find me. So I did post that there. So yes. So we can go ahead. I have another viewer on here. It says there's 4 people on here now. So we're going to be talking about flu season and the vaccine and stuff like that. So I'm trying to get people a chance to find me before I really get started. Hey Chantel, thank you for joining. I appreciate you. I'm trying to wait for people to get on. So and who knows, it may be for a new set and group of people that I'm trying to reach to add on. Hey Lynette, thank you for joining. Lynette is a nurse practitioner that I work with and collaborate with. We do home visits and pain-free clinic. We do pain management. We allow our patients to make good health choices so they can have their overall health can be improved, so their pain can be more managed and more controlled. So please get on, invite and share. What time is it now? It's 8:07. I'm gonna give it another 3 minutes and then we're gonna get started. There's a big chunk of my time have been talking right now to get people a chance and opportunity to find us here on the Medical Monday page. Hi, Wayne T. Jackson, my Apostle Wayne T. Jackson. That is my spiritual dad. I love you with the love of the Lord. Thank you so much for being on. I really do appreciate you joining. We're going to be talking about the flu vaccine and the history of vaccines and stuff like that. So we have 5 viewers right now. Hey, Lisa, thank you for joining. We have people are joining us, so we're going to get right into this. So let's start talking about vaccines. Okay, for those of you that are under the sound of my voice, and I want you to comment in the comment section, how many of you think vaccines originated by the government, that the government created vaccines? It's something that the government came up with to help the medical industry. Hey Victoria, hey Regina, you found me. Thank you for getting on. How many of you, this is a question in comment section, how many of you out there under the sound of my voice think that vaccines were created by the government? Hey Doris E, so thank you for joining. Doris, my sister from Great Faith, thank you for joining on. So I want you to comment in the comment section, right? But okay, good. Hey Daryl, thank you for joining. Thank you, but welcome back home. I heard that you went down there to help those people in the hurricane areas to get their electricity back. God bless you for going down there to help. Okay, Jonah said, I'm not sure. But you guys have, this to the conspiracy theorist, I just want to know, hey. So I'm going to repeat that again. I need you guys to comment. How many of you think that vaccines were created by the government? You could say yes or no, or yes it was, or whatever. Vaccines were created by the government. I'm about to expose the truth to you all so you guys can know the truth for yourselves so you can make an informed decision. So let me get right into the meat of things. Okay, vaccines was based upon a premise from Africa, the continent of Africa, okay? Just like the hidden figures, how they keep things hidden from us and don't tell us the truth. A black African did the first vaccine here in the United States. So we are taught in medical school and throughout your sciences, you're taught about Pasteur and Salk and all these people who created vaccines. But the original founder was by Owonomous. I know he was a slave in Boston when they had the outbreak of smallpox. So people were dropping everywhere. People were dying everywhere, okay? So this African slave, what he did was he took one of the pustules and extracted some of the pus that was in there, cut himself, taped it over, and did the same thing for his master. And after they did that, their immune system was built up against smallpox, and they were able to treat people in the Boston area with that. Now, but they're not telling you guys that. Hey, Marita, thank you for joining. Hey, Sandra, thank you for joining. So that is how vaccines began. It began during that time. You can go to our page, well, my link, I should tell you, and we have a download for you that we're going to be talking about vaccines and things of that nature, where you can put your email address and things like that and download what I'm talking about today. You can push on it and read the whole article. I can't go into all of it in much details, but I do have to say, after that, on that premise, from an African, vaccines have evolved from that. So vaccines started on the continent of Africa. Okay, the government didn't create it. Of course, they do the CDC, which is the Center of Disease Control, and all of that. They do manufacture it now, and it's part of the government now to this day. But it was not originated and created by the government. So let's be clear on that. So another myth I want to talk about, and don't get me wrong, for you conspiracy theorists out there, you know, with the Tuskegee incident, when they had all these men, hey Alicia, who were diagnosed with syphilis, and they studied them without treating them so they can have all this documentation. I understand and I get that. So, but at the same time, vaccines do work, and I'm going to share that you go in my life. Whoop! So you could I can be transparent with you. I don't get the flu vaccine as a doctor every year either. So how do I make a decision whether or not I'm going to get a flu vaccine? Flu vaccines have been around for quite some time now. Flu vaccines are created and designed for the most lethal and deadly strain that they figure that's going to, hey, Marquita, hey, Sandra, hey, Alicia, hey, Rita. Every year for the strain that is going to hit the population or hit the nation, they create the vaccine before the flu hits. Hey, Frederico and wife Mobley, hello. What they do is, at that point, they make a strain that they say that's going to hit, and I do have a question in how do they know that's the one that's going to hit? So, you know, I do ask questions, and in the back of my head I have those questions. Hey, Esther. So what I do is, I'm led of the Holy Ghost. So I have not gotten a flu shot every year. I do not do it every season. I am a medical professional and I'm a medical provider. And this year I was led to get my flu vaccine. And the reason being, with all the things that are happening and the climate that's going on globally, you know, how things are happening in regards to pestilence and stuff like that. And, you know, Psalms 91 be upon us. Of course, it said 1,000 will fall by, don't be a pestilence. Don't be fearful of arrow that fly by day or the terror by night. And then, you know, it says that 10,000 might fall at your right hand, but none will not come nigh your dwelling. I do believe that, and I do stand on the word of God. But also at the same time, I'm Holy Ghost led. So this year I felt a need to get my vaccine. And again, does that mean that you will not get a cold? Hey, Kathy. Hey, Eric. Thank you for joining. Does that mean that you will not get a cold, or that you will not be exposed to another virus that is not in the vaccine stream? No, there's over 100 million strains of viruses and things of that nature out there. And those of you under the sound of my voice, if you get a runny nose or cough or the flu, please stay at home. Yes, please stay at home. I went to the health food store. This is a true story. It just happened to me. I went to the health food store on Sunday, and the lady that was at the cash register was honking and sneezing and said, "Could you please speak up, because I am clogged. My nose and my head and my sinuses, I can't breathe." Why did you come to work to expose everybody? So, I got to hand my money to you. You handling my packages and everything. And I have to say, at the end of the day, I started sniffling. So I had to get out my silver. I had to get my vitamin C out. I had to drink hot tea to fight that thing. Now, mind you, I did get my flu vaccine, but at the same time, I'm telling you, the flu is the strain that they say that is going to be the worst of the year and cause people to die and stuff like that. Hey, Maybelline, please, if you're sick, don't go to work. Don't expose your coworkers, and don't expose the public to your germs. That is so disrespectful and have no regard for nobody but yourself. It is not nice and is not polite. Hey, Shelly, thank you for joining. So anyway, that's what vaccines about. Now, this is who they say should get the flu vaccine. Number one, if you have a chronic illness or disease, and your immune system is already compromised. So, and I also say, if your body is not at its ultimate condition, or your health or your faith is not where it should be. There are people of faith, and I'm one of them, and some of you under the sound of my voice, who said, I just won't get a flu vaccine. I'm trusting and standing, believing in God. Good for you. But then there are some people that are under the sound of my voice whose body is already weak, and then the flu vaccine can provide for them, because their faith is not where it should be, number one, and then their body is in a state where they are weakened to where if they get the flu, it could kill them. So those are chronic illnesses such as chronic obstruction pulmonary disease, which is like your asthmas, or I shouldn't, I cancel that out, like asthma, like COPD, which I say chronic obstruction pulmonary disease, anything that obstructs your bronchioles, bronchitis. People have that chronically. They recommend that they get the flu vaccine. Then they recommend for those that are diabetic, because the immune system is low in those type of individuals. The elderly, because when people get younger and younger or mature, that the immune system gradually goes down. Okay. Let me go back to another reason why I said I also decided to get the flu vaccine for myself this year, is because I am doing more. So being the fact that I'm doing more as far as work, my body is experiencing a level of activity. Hey, Mycia. Hey, Dakisha. Hey, Mimi. Hey, Jamie. Now, this is just me talking. You don't have to follow my advice, but like I said, I prayed and I felt led to do it this year, because I'm doing things that I've never done before at a level and an intensity that I've never done before. So when your body is experiencing things that it never experienced before, that S word, that stress word, your immune system is going down. I get Ethan shot every year because he has always had to fight really hard in the season to stay well. His immune system is building, but I don't take chances. I pray over him, and yeah, you could do a combination of things. Absolutely. Use wisdom. You got to understand what is best for you. Your immune system is in your gut. So those of you that are under the sound of my voice that have antibiotic therapy, believe it or not, antibiotics is for bacteria. It is not for a virus. Those are two different organisms. Viruses and bacteria are two separate organisms. So you can't use that's what they teach us. You can't use an antibiotic to fight a virus. And so that's when they came out with Tamiflu. If you guys know anything about that, that's how they treat the flu. How do you test to see if the person actually have flu? Hey, Brother Green, they do this nasal swab, stick it in this thing. You get 2 lines is positive, 1 line is negative. So if it becomes a positive, that person has flu, and you give them Tamiflu, but it has to be within a 48-hour window, the first 2 days of being exposed and having symptoms. What are those symptoms? Congestion, runny nose, headache. This is classic. It feels, a person will say, it feels like my body has been hit like a Mack truck. Every bone and joint hurts. That's classic for flu. So you really need to get to your doctor right away, or call them right away and say, please don't take what I'm telling you to get some Tamiflu and ain't nothing wrong with you. Please don't do that, because then viruses can also mutate and change, and so it can become resistant to Tamiflu. So only use it when you need it. Hey, Sister Henry, thank you for joining. Everyone, please invite and share. So this is how vaccines work. Let me tell you how it works. I told you about the smallpox story with Owonomous, the African slave who brought vaccines to the continent of the United States for them to take and use. Okay, so but anyway, make a long story short, your body is not intramuscular, it's in the skin. So when they expose you to a little tiny bit of the virus, and your body said, hey, this is something foreign, let me go look at it and see what's going on. So it sends cells in that area to look at it and grab it up. And what it tells and say, this is something that should not be here, so we need to fight it. So you have a whole course, a line of a system of cells that will start replicating antivirals or antibodies to fight that particular strain of bacteria off. So some people say, oh, I don't like getting the flu vaccine because every time I take it, I get sick. For those of you under the sound of my voice, if that be the case, I don't want anybody to be sick when they do this or whatever the case may be. But at the end of the day, it's better to get a little sick or than to get the flu and die from it, because there are people that get the flu and don't have the wherewithal or the strength in their body or the faith to fight it off. So you have to use wisdom in your decision and your choices. Okay. Hey Maria, thank you for joining. At Bethesda Holistic Center, I gave you our telephone number at the beginning. That's 248-356-1111. We are taking names for those who are interested in the flu vaccine, because we want to, because sometimes I over order, under order, and then it just sits on the shelf and then it goes bad. So I just want to make sure that we order enough for the people that are interested. And so guess what, guys, we're not forcing you or telling you this, but I'm giving you both sides, and so you can have a clear picture on what you need to do to prepare for this this strain of flu that is out here this year. Okay, so the next thing I want to advise you guys of too is that you can use some natural things to build your immune system up. We have a product that's called IsoImmune, and it is a zinc spray. Zinc is a mineral that is in a metal family. It kind of works like silver, and I'm gonna tell you about that in a little bit. Hey Rosalind, thank you for joining. And it's a spray because zinc is best absorbed through the mucous membranes, and most oftentimes this is where the flu virus actually gets its entrance away. Your eyes, because they're membranes and everything, your nose where your membranes, and your oral mucosa is your mouth. So the zinc spray, when you spray it in your mouth, gets right absorbed in all the mucus areas in your face to help fight off viruses. Okay, I cannot say that anything that I'm prescribing that is natural, I cannot say that it prevents disease, cure disease, or anything like that, but I'm just can tell you how it works, the premises of how it works. Okay, silver psyllin we also have too. We're going to provide a link for that, and let's tell you how we have a liquid form. It's called silver psyllin. It has silver in it. It's liquid silver. And how does that work? Let me tell you how amazing God is. Okay, silver psyllin, everything has energy. You guys know that. You have energy. God is energy. The Holy Spirit is energy. Everything is energy. The light, when you turn on that switch, that glare that is over my head, all of that is energy. Viruses and bacteria, even bad things, have energy. So what silver does is like throwing a piece of metal into a circuit and recircuiting and turning that circuitry, or damaging that energy in that viruses, because viruses are very smart. Some viruses can go into your own cells and hide there and say, I'm part of the body, and it start replicating and making more viruses in the body. So what silver psyllin does, hey Jubilee, thank you for joining. Hey Clint, thank you for joining. So what silver psyllin does, the silver is like throwing a monkey wrench in the electrical circuit of the virus. And then and then the body was like, hey, this is something that is not right. This is bad energy in here. Let's get rid of it. So that's how silver psyllin works in the body. And we have a link for you where you can go to that and go to our website and order that and buy that right away. This time of year, I recommend that you follow the instructions on the body and take a little bit of silver every day, because it helps build up your immune system, or silver that is in your body. If something ever comes in to evade the body, it actually destroys or disrupt the energy of something negative that gets into your body, for your body to signal to say, hey, we need to get rid of this pronto. Okay, another thing that I highly recommend is vitamin C. And vitamin C is very important because it helps build up your immune system. Okay, vitamin C will allow you to be able to build up your immune system at the level of the gut, because that's where your immune system is, to be able to build it up, help with the probiotics and all those type of things in you to help you keep your immune system up. So there should be a link coming on up in the comment section in regards to it's called C Light, and you can order that. It's only like $14 or something. I highly recommend that you do that, because there are different types of vitamin C's out there, and you want one that is super absorbable. There's a lot of junk vitamins out there, so I'm not going to promote or tell you to get something that I don't use or use for myself. Okay, so another thing that I do also, along with zinc, I also do copper, because copper is also a mineral in the metal family. So it acts again like throwing a wrench into a fuse box, which kind of mess up the circuitry of anything that is in your body that should not be there, be it viruses or bacteria or anything like that. So I highly recommend that you guys do that. So again, hey Daryl, thank you for joining on. Those are who and we advise people to get the vaccines for. We talked about that weakened immune systems, people that have chronic illnesses such as COPD, which is chronic obstructive pulmonary disease, diabetes, people that have their immune system is low. Some people that just had chemotherapy and things of that nature. If your immune system is low, you can do that. Now, guess what? Flu vaccine don't always have to be a shot. Did you guys know that? Did you guys know flu vaccines come in other forms? Hey Sheila, thank you for joining. Did you guys know that? Yes, no? Can you comment? Can you say something out there? There is also a nasal, hey Angie, thank you for joining. There's a nasal spray in the form of the flu vaccine too. So it just goes swoop, swoop right in the nose. Most often we give those to children because it's less painful than the shot or whatever the case may be. So for those of you, no, I didn't know that. Yes, I'm giving y'all information that y'all ain't heard. I'm happy. I was so excited about Medical Money today because I knew I would be sharing advice for the first time that you guys didn't have information on. So, but anyway, you definitely can request it. You see it everywhere, all over the place at the major drugstore chains. Even if you just go in the area, the pharmacists back in those areas are trained to ask you to get your flu shot today. I mean, again, I say use wisdom and exercise your faith. If you're saying that I don't need a flu shot, I'm trusting and standing and believe God, I am standing and believing God with you. But at the same time, you have to use wisdom. If you're someone under the sound of my voice that have health challenges, use wisdom. Give it to me now. Hate needles. Oh, okay. Yeah. And also remember the gateway to viruses is in the eyes, nose, and mouth. Please avoid shaking hands as much as possible during the season. Make sure that you wash your hands. If not, they say use hand sanitizer, but I do believe at the end of my day, because I go from house to house and I'm not going to use everybody's bathroom or sink, I do use different type of hand sanitizers that say it kills 99.9% all germs and viruses. I do that, but there's nothing like a good hand washing at the end of the day. And how do you wash your hands? They say the best way to wash your hands is to sing a song from the beginning to end, like either Happy Birthday or the ABCs. You want to get between the fingers and all that other kind of stuff. You want to make sure you get under your nails, all that kind of stuff, and wash your hands and make sure they're completely dry. Even after I do that, most oftentimes I will use hand sanitizer after washing my hands. Another thing, people, when a person cough or sneeze, they say use a tissue and catch it. No, that's the worst thing that you can do, because now you contaminated your hands. The best thing to do is an elbow cough or elbow sneeze. Okay, because most people are not grabbing your elbow or whatever the case may be. Even nowadays, when as medical professionals, even with my team, I don't even shake their hand. We elbow bump this way. So we make sure that we're not transferring any germs. Viruses can be transferred from paperwork, from money, and things of that nature. Viruses do have what we call a shelf life on tables and countertops and things of that nature. So you got to make sure, those of you under the sound of my voice, like this morning, after I prayed through my house this morning, and I had a can of Lysol too. I use practical knowledge, and I use the Holy Spirit knowledge, and I walk through my whole house, spraying my whole house, saying anything that is not of God, you cannot rest, rule, and abide here. This is the house house of the Lord. Yes, this is the house of prosperity and wellness. We are divine health. We are divine healing. And by the stripes of Jesus Christ, we are whole. So I went through the whole house today spraying, and even opened the door and kicked everything out that should not be here. So again, use wisdom in regards to your decisions that you make in regards to your health. Hey, Catrilia, thank you for joining. Hey, Laquita, thank you for joining. Say that, Dr. Grace, hand washing is the greatest. Yes, it is. It definitely is. You need to be washing your hands for sure. Okay, make sure that you do that. And those of you that are under the sound of my voice, like I said, if you get a runny nose or a cough and you're not feeling your best, make sure you get on it right away. And you got to stay hydrated, because if you're dehydrated, you don't, hey Marcus, thank you for joining. If you're not hydrated, your mucous membranes are not moist to develop a barrier to keep viruses and bacteria out. So hydration is key. We talked about that. We talk about that almost every video, about how much water you need to be drinking a day. That's 2.2 divided your body weight, and whatever ounces that you come up with, that's how much water you need to be drinking a day to keep hydrated. Okay, and guess what? Pop, tea, juice, it's not water. No, it's not. Water's chemical form is H2O. So if you alter that anyway, it is not pure water. So you need to make sure you get your water and your hydration in. So let's say worst case scenario, you do get the flu. A person may get a flu or get a virus or whatever. I said, remember, hey Joyce, thank you for joining. You need to get to your doctor right away. Within those first 24 to 48 hours, you need to get treatment. Or like I said, it has to be during that time. If you're past that, and it's just a common cold is a virus as well. Your body is very strong and very smart. So most oftentimes I tell people, you do comfort measures, you have to ride it out. Rest. You got to make sure you get your proper amount of rest. If you're not resting well, you're under a stress state and your immune system drops down, which allows you to be open to more than just viruses. So you got to make sure you get your rest. Okay, that's very, very key. All right, you got to get your rest. You got to get your fluids in, your hydration. Okay, you got to drink your water. There's so many things out there now where you can get your electrolytes in too. We also have a product that's called Hydrate, which is like a little stick or a little canister that you could put electrolytes in. I prefer that you get some electrolytes in if a person feels that they're becoming a little congested, their throat is feeling kind of funny, or get that Isoimmune that I talked about, begin to spray it, that has that zinc in it, you know, and your Silversilin. I can't say that as much as possible. Get your Silversilin, please. Yes, pure water. It is now 8:33. Let me give you guys a couple of links that I want you guys to go to in regards to the Silversilin. You can go to www.bw-center.com/MM for Medical Monday. H as in Harry, T as in Tom, M as in Mary, L as in Larry. Again, that's www.bwcenter.com/MM for Medical Monday. H as in Harry, T as in Tom, M as in Mary, L as in Larry. And you can get your Silversilin right there. Okay, you could just click on it and buy now. Yes, get that silver in your system. The Isoimmune, the link, she posted it a little earlier. That's Grace Patterson, my name, .isogenics.com/products/individual/immune with zinc. So she's going to post that again, and also the C light for the vitamin C. She's going to post those links again. Again, you need to start working on that right now. Okay, guys. Now, okay, let's say don't always demand antibiotics for a cold. You know, antibiotics is the only thing that worked for me. I want an antibiotic script now. Okay, so guess what? Being people that have that type of attitude and want antibiotics every time they get a nasal or cold or something like that, that's why we have these what we call killer strains, or what we call bugs, that we cannot treat now, these superbugs. You know, that flesh-eating bacteria that eats people's flesh is because of overzealous use of antibiotics, because these bugs are like, they're smart, they mutate. They're like, oh, that's penicillin, I'm just going to change how I work, and I'll become resistant to it. So you guys, don't your body, like I said, your body was, you're fearfully and wonderfully made. So a lot of things are self-limiting if you just do eat right. Make sure you get your rest, keep your body moving, keep your body detoxed, and all that good kind of stuff. Your body can heal itself. We were not created to die. If you guys know that, right? We were not created to die. We were not created to age. We were not created to for any of that. So, when Jesus came, he restored all of that back to us. So please utilize it by using some wisdom. Hey, Nick, thank you for joining. Hey, Gwendolyn, thank you for joining. Okay, now, guys, please invite and share this broadcast. Please invite and share, get people on, because I am on Medical Monday page. I'm not on my friend page, my personal friend page, like I normally am, because I am taking my business to the next level. So I need to be on my business page. So please, you guys, now we can, I'm going to keep talking, but if you guys have any questions, you can begin posting them now. Wow, this is good to know. You're welcome. Hey, Nicole, thank you for joining. I appreciate you joining on. So again, if you are not feeling your best or not feeling well, please stay at home. Make sure that there's a difference between sinuses and viruses, and you got to know the difference between the two. There are sometimes when people allergies flare up because they're exposed to different allergens. There are allergens. There are dust mites. There's dust. There's dandelions and all of that stuff. A lot of people now, the big thing now is going to an allergist and getting tested to find out what a person is allergic to, so they could prevent being exposed to those things, and their sinuses won't be affected. I want to say this too. Some people, I know I'm probably going to get this question about echinacea. Echinacea, believe it or not, is a oral form of vaccine. And let me tell you how that works. Echinacea, if you look up echinacea, you will find out echinacea is from weeds. Yes, it is. It is a weed. It is from a plant, but if the plant is a weed, so you swallow that echinacea and it goes into your system, and your body sees it. Hey, what is this? So it sends all those cells. It sends cells to, once it gets into your bloodstream, after you digest it and gets into the blood, it sends your immune system cells, your killer cells, your T cells, and everything to look at, see what it is, and to develop antibodies for the being exposed to echinacea. So that's how echinacea works. It has your body to mimic whatever allergen or anything that your body is exposed to. So when your body is exposed to something, those cells go out and attack it immediately to get rid of it. Hey, Joyce, sinus infection every October through February. Okay, so if you're having a sinus infection every October through February, that means that your gut knows when it's October and then when it's February. So your gut, just like immune system, goes down. So if you know it's every October through February, you need to start working on your immune system when? Not in October. You need to start working on your immune system before then. So you need to be working on it in June, July, August, getting ready for this October to February. You don't wait until, you have to be proactive. So you need to start taking your silvercillin every day. You need to start taking your vitamin C every day. You need to start taking your zinc, your copper, and things like that before October comes. Don't wait until then. Hey, Teresa, thank you for joining. You need to start working on your immune system then. It's very important that you do that on the front end, not on the back end. Hey, little Baron Cole. Hey, Kim Cole, thank you for joining. I appreciate you guys joining on. It's very important that you do that. Hey, Donita, it's very thank you for joining. Please invite and share. So it's very important that you start working on your immune system then. You don't wait until something happens, okay? It's very, very key that you start working on that. If you know that block, a window, is when you have a sinus infection, okay? You probably need to get with an allergist. You probably also need to get your sinuses x-rayed and see what's going on in your sinus passages, if there's any blockages, and then those type of things. You got to watch your diet, because what winds up happening during that time, we're going from summer to fall, is a change of season. You probably need to detox. You probably need to get all that old food that's in your gut, because remember, your immune system is in your gut. But if it's blocked up with fecal matter and crap, because that's what it is, your immune system cannot work effectively. You need to be having a couple of bowel movements a day. We are taught in medical school, and we are taught in the medical profession that everybody's bowel habits are different, and whatever your pattern is tailor-made specific for you, like every day, once a day, once a couple of other days. But believe it or not, you should be pooping every day. Because if it's just sitting there, again, your immune system can't work. The poop is in the way. So it sounds like to me that you need to go ahead and get that taken care of. It's very, very important that you do that. Hey, Lisa. Hey, Tika. Let me see if is there any question. What if people touch your face? All the older people at my job go for my face. Okay, you could do like this. Not today, I love you. Don't let them touch your face. No. Or if you don't feel confident enough to move your face or whatever the case may be, you need to carry a whole bunch of little alcohol swabs and swab. I don't know. You have control over that. You can tell them, no, don't touch my face. This is cold and flu season. Don't touch my face. And little old people, especially if you're in a nursing home and stuff, they scratch in different places. They touch different places. So you don't want them touching your face. No, don't let them do that. Duck. Hey, Hidden Treasure. I know it sounds comical, but it's true. It's true. Too close to your personal space. Yes, that's absolutely true. You have to use some wisdom. Hey, Kenyatta, thank you for joining. Please, you guys can some more questions. I might have missed some. Yeah, 3 feet away. You got to remember, sneezing goes a long way. When you sneeze, that spray, that mist goes out, and air droplets are aerosols. You can inhale those in, and that's how people can get sick too as well. Laquito Wright has those cute cheeks. Oh yeah. Okay. Yes, it's true. Chronic kidney failure. Okay. Marquita Lucas, chronic. I don't know what chronic kidney failure is. That a comment or somebody answering something else? I don't know. It is so true. Yes, they do. I once worked there too. Yes, so you can be polite. You don't have to be mean. And if they do get a sneaker touch in, you need to be like, Mr. or Mrs. So-and-so, I'll be right back. And then you need to go somewhere and wash your face. If you got makeup on, reapply it or something. But you got to get that stuff off your face because, you don't want to get sick. That is so true. I'm breaking up. I'm sorry that I'm breaking up. What you probably need to do, guys, I know you probably need to go on and get back on. I think I do have all my apps on my phone closed. So make sure that you guys have your apps on your phones closed as well. Is there any other questions, guys, or any comments in regards about everything that we talked about? I'm here to answer your question. Dr. Grace Marcus asks if you use hand sanitizers too much, is it bad for you? Okay, that is a good question. Is it bad for you? Well, it kills germs. It can make your hands a little rough and wrinkly and dry them out a little bit. But then you got to also know that you're absorbing alcohol in your system, and then your body has a way of detoxifying itself to get rid of the alcohol. Your liver's what does that. But again, that's the reason why we need to detox. Remember, we talked about detoxing. I detox every day. We have a thing that's a product called Cleanse for Life. I drink that every day because it cleanses at the level of the cell. So being that I use a lot of hand sanitizer and I'm exposed around a lot of people, I want to make sure that I'm detoxing daily. That's for me personally. But you can detox, once a week. A good detox is good old school fasting. We talked about that. So those are good things for you to do. Bless info. LeBaron Cole, is it good ideal to drink silver water? If so, how much a day? There is what we call liquid silver. You need to follow the instructions on the bottle for you to take. I don't know those directions off the top of my head. I guess I can look it up right quick for you. I'm a little bit different. Sometimes I don't follow the instructions, so don't be like Dr. Grace. Don't be like Dr. Grace. Make sure that you guys go ahead and follow the instructions, so you can make sure that you taking it right. but you need to be taking it during this season to make sure that your immune system is being built up. Let's see. I am. Okay, let me see what we got cooking here so I can tell you what the instructions are for your silver every day. So is alkaline water the best water to drink? Oh, I get this question almost every video. Alkaline water is good, but there is a certain time you drink it and certain times that you don't. Okay, any of you M&Ms out there, my Medical Monday peeps, can y'all answer that question about alkaline water for this lady? So I know that you've been hearing me and listening to me in regards to alkaline water. Can you guys share with her alkaline water? When is the best time to drink it? Okay, silver psyllium. Let's see here. Okay, the silver psyllium that we have is one of the purest out there. It contains 15 ppm of purified silver per serving. This incredibly powerful non-toxic form of silver with zero buildup in your body, so it does not cause agoria, which is blue man syndrome, which means you can have some bad silvers out there and the silver can just start depositing in different parts and places of the body. Let me see if I can oh, give me 1 second, guys. Let me go grab my bottle. Hold on, and I can read the bottle for you. Can you guys hold on just 1 second? I'm gonna go run and get my bottle. Hold on. Hey, my silver psyllium bottle. I need my silver psyllium bottle. Okay, here it is. This is my silver psyllium. It's almost gone. I need to order me some more. Okay, so it says here, as a dietary supplement, take 5 ml, which is a teaspoon, approximately 1 teaspoon orally per day, as directed by your healthcare practitioner, which is me. So you need to be taking this a teaspoon a day. Sometimes what I do, I have like these little cups that I use. So I might double that sometimes, depending like if my nose is feeling funny, or I've been around somebody who decided to go to work and expose me to their germs. So I might up my dose. So this is it right here. So I'm not asking you guys to do anything that I'm not doing myself. So drill, watch it. Okay, let me answer. What to bring them as a guest? Okay, no. Okay, I don't know if anybody answered the alkaline water, but I'm going to answer it right now. Alkaline water should be only you should only drink it between meals, because God created you and designed you with acid in your tummy, which is a low pH. So you need a low pH in your stomach to break down food, kill bacteria, to kill viruses and stuff like that when you eat. So you should not drink alkaline water while you're eating, because alkaline water has a high pH. So when you drink it while you're eating, it brings up the pH level in the tummy, so you can't get the breakdown in the food. You can't adequately digest. A person is not killing the bacteria or the viruses that are in the food because now your pH is too high. So I highly recommend that if you're going to drink alkaline water, to be safe, the minimum is 30 minutes before. But an hour before or an hour after a meal will be the best time to drink alkaline water. Okay, I do drink most of my alkaline water when I'm doing a cleanse or when I am doing a fast where I'm not intaking any food, because bacteria, germs, viruses, and those things of those nature cannot live in an alkaline state. So while you're fasting, sometimes your immune system goes down because you don't have the nutrients that you need for your food to keep your immune system built up. So alkaline water is a good time to drink while you're fasting. Hopefully that answered your question. What if you have acid reflux? Okay, acid reflux, alkaline water will be good for that. But again, I don't recommend that you do it while you're eating, because at that time, again, you want to kill the germs and bacteria of the foods that you're eating. So acid reflux means that you have too much acid in your tummy. So you might want to drink alkaline water some other time during the day to get that regulated. Also, remember this too, acid reflux, you have your stomach is like a little balloon, like a little sack that sits like this. Okay, where my hand is, that's where our tummy is. This is your esophagus that goes up to your mouth and you eat. Your food is beginning to be digested by your salivary glands, and it secretes saliva. Saliva has enzymes in it, so that's what moistens the food to break it down. So you chew it, you swallow it, and it goes down. There's a ring of muscle here that clamps down once the food gets in the tummy so it can start being digested. Okay? So sometimes this ring right here gets weak for whatever reason. It is a ring of muscle. So a muscle, it clamps down. So an acid reflux, sometimes that muscle lose its contractibility, its ability to contract. So what causes the contraction of that muscle? What controls it? Remember we talked about muscle contraction. Sodium and calcium cause contraction, and to relax it, you need magnesium and you need potassium. So after you eat, you need to clamp it down. So what winds up happening, someone's electrolytes is off, so it's not clamping down like it should. And then so you need to avoid things that will cause this not to work like it should. So what causes that ring of muscle around the esophagus that connects to the stomach not to work good? Spicy foods don't allow it to clamp down like it should. Caffeine doesn't allow it to clamp down like it should, because caffeine is a muscle inhibitor, so it don't clap down like it should. So, and then you got to stay away from acidic foods and things of that nature. So though that's how that works. Hopefully that makes sense to you. What we normally do, tell people that have chronic reflux, that have had it for a while, I do believe in prayer and the power of prayer, number one, but sometimes they might have to elevate their bed, and then some people like, I can't afford, okay, pillows is number one, or you could put 2 bricks at the end of the post of the bed to have your bed at a level. Please don't eat 30 minutes, no more, less than 30. Don't eat and lay down, because that's not good, because that your body is churning and working, and then the acid can get up in your chest. That acid burn can be so bad to where it's scary, to where it can feel like something is going on with your heart. And it can also trigger respiratory problems. It can cause people to go into an asthma attack. It can do a whole lot of stuff with the acid backing up into the esophagus, which is not a good thing. Hopefully that answers your question. What happens if you never had the flu shot but declined to take one? You don't have to. That's totally up to you. You have a right to decline whether or not you take the flu shot, and no one should have to make you take one if you don't want one. So you don't have to take a flu shot if you don't want to. For those of you who are just chiming in now, we asked the question about where the vaccines originate from, and I asked the people, do they know where the flu vaccine originated from? How many of you out there, now those of you who started with me beginning, you can't answer. Those are just recently chiming on. How many of you think that the government invented vaccines? Say yes, no, you don't know, or whatever the case may be. Hey, Melania, thank you for joining on. Hey, Catrilia, hopefully I'm saying your name right. Thank you for joining on. Hey, Ramona, thank you for joining on. Okay, I talked about earlier exactly where vaccines came from. So you guys have to watch the beginning of the video so you can hear where vaccines originally came from, and the history of vaccines. Or go to my download. It's like a little study guide. The download is called Flu Season and Flu Shot. It tells about the history of the vaccine and who is recommended to get the vaccine. You can go to www.bwcenter.com/MM for Medical Monday. H as in Harry, T as in Tom, M as in Mary, L as in Larry. And you can put it's free. It doesn't cost you anything. Put your first and last name in there and put your email in there and download that, and it'll tell you about the history of vaccines. And you can also, the silver ceiling is posted right there. You can buy it right there. You don't have to go anywhere, go far or anything like that. And it comes directly to your front door. You don't even have to go to the health food store to get it for you. Okay, Nick, good information. You're welcome. Hi, La Jessica. Thank you for joining. We have 6 minutes. Is there any other questions that I can answer for you guys in regards to the vaccines, flu vaccines, how to get in touch with us? Again, my name is Dr. Grace Patterson. I am a medical doctor. I do have my medical degree. Remember that the information that I give to you is not to diagnose, treat, or prevent anything, but to give you information so you can make an informed decision about your health personally, okay? So you can make a decision that is best for you and best for your family. I can't wait until the next segment. Oh, thank you. Our next segment is going to be off the chain, so hopefully you guys will join us on that. We're winding down, guys. It's 8:55. I have 5 minutes to answer any questions. Should I get one? I'm on dialysis. Yes, that is considered what we call a chronic illness. So people that have chronic illnesses like dialysis, chronic obstructive pulmonary disease, diabetes, any of those things are considered chronic illnesses. It's recommended to get a flu vaccine because people that are battling chronic illnesses, their immune system has a tendency to be not where it needs to be. So the flu vaccine can help them fight the strain of flu that is deadly for that season. I understand. Medical Monday is every Monday at 8. Okay. Taking Clea, is that okay? Okay, yes, you're taking that for Clea is a good oil that you use. They advertise it for weight management because it is a good oil, and anytime you do a good oil is good for burning fat. So yes, Clea is good. Sometimes I alternate between Clea, flaxseed, and omega-3, 6, and DHA, depending on how pure it is. Because I, as a child, had a diagnosis of fish allergies, but there are some omega fish oils out there that doesn't smell like fish. Doesn't have the fish protein in it, and I'm able to take it without any problem. We have that product available too as well. You can go to our website and look that up. It is called omega-3 fish oil, and again, it has a lemony taste. It doesn't seep through your pores and make you smell like fish or anything like that. Now, for me, as a child being diagnosed to where I can't do fish and be able to take this omega-3 without a problem, without a reaction, because I remember one time I was out on a date. This is a true story. I was out on a date. Thought I was looking cute and everything. And then we went to Red Lobster, and all crab meat is not created equal. Now I used to have these weird allergies, which means that I can do shellfish, but I can't do fresh fish. Or freshwater fish. So they had crab meat, but it was made with fish, and my lips said poof. And it was so funny. The guy that I was with, he said, "Do that again." I said, "This ain't no show." But anyway, I said all that to say, if I could take the fish oil, the omega fish oil that we provide without having a reaction, is the purest of forms, and I highly recommend it. I love this broadcast. Oh, thank you, Chantel. Thank you. I welcome all the new, we call them M&Ms, Medical Mondays. We appreciate you coming on. We got 2 more minutes. Did somebody ask a question that scrolled by and I didn't see it? It says, where do allergies come from? Is it hereditary? It can be hereditary, because my mom told me that when she was a small child, that she used to have allergies and allergic to things used to make her itch and stuff like that. So when I was a child, I had some of those issues as well, in regards to eating fish, nuts, and things of that nature. I can eat peanuts, but I recently had some almonds. Years ago, I couldn't even do almonds, but growing in faith, and making sure that my body is where it needs to be as far as immune system wise. I don't advise anyone to do this. If you have an allergy, don't be experimenting at home. Do not try this at home. So to answer your question, yes, it can be hereditary. It can be genetic. Yes, it can. But the God that I know can supersede genetics. So like I said, if I could do a fish oil, that has to be a good product and a miracle of the Lord. Yes, Teresa, this was fantastic. Thank you. Oh, you're more than welcome. Any other questions? We're winding down. It's 8:59. I appreciate you guys for tuning in. Again, for those of you who came in on a little bit late, could you please look at the beginning of the video, scroll through the comment section. We do have some links. My name is Dr. Grace Patterson. I'm in the Metro Detroit area. The name of my practice is Bethesda Holistic Center. Our address is 21411 Civic Center Drive, Suite 102, Southfield, Michigan 48076. And our telephone number is 248-356-1111. That's 248-356-1111. You can go to our webpage, which is www.bw-center.com/mm .htLM, that's H as in Harry, T as in Tom, L as in am I saying that right? HTML, yeah, Mary Larry. I have to get that right. For you to get the free download, it's like a little study guide where you can review everything that we talked about in a written form, and you could get the silver sealing right there on that link. You can get it right then, right there. Okay. I highly advise those of you under the sound of my voice. You can do a combination. You can do the flu vaccine if you want to, and get these products too at the same time, or you can just do your flu vaccine, be done with it, or just build up your immune system the natural way with this silver sealing, the isoimmune, and the C light, and stuff like that. You're more than welcome. We can help you and walk you through that. I am so excited that you guys tuned in into Medical Monday on tonight. I'm glad I was able to share some information with you that you haven't heard, that you heard for the very first time. I consider it an honor and a blessing for those of you that tuned in. Thank you so much again. Until next time, next week, same time on Medical Monday with Bethesda Holistic Center, where we say that we calm and focus the mind, we help nourish and detox the body, and we help awaken your spirit. So thank you so much for attending Medical Monday. Until next week, 8 p.m. on the Medical Monday page, everyone. Thank you so much. Grace and peace. God bless. Bye for now.